Welcome to the Patient Educators Update, where we get together and talk about patient education in a clinical environment. My guest, as always, is Fran London. Hi, Fran.
Hi, Chuck.
My name is Chuck Jones. I'm Executive Vice President at Synergy Broadcast Systems, and we sponsor the Patient Educators Update. Fran London is our weekly guest, and Fran is the Patient Education Specialist at Phoenix Children's Hospital in Phoenix, Arizona. And in addition to being the patient education specialist there, Fran is also a noted author. Her most recent book is No Time to Teach. And this book has been out since, let's see, how long has it been out, Fran? I threw you a trick question.
Yeah, 2 years.
Yeah, 2 years. And in 2010, it was voted Book of the Year by the American Journal of Nursing.
Yes.
So it's a really good book, and it's a book that we, get out of the camera here, that we have most of our conversations about on the show. But today we're going to vary from that, and we're going to talk about something that I read in some of the news feeds that I look at the other day that I thought our viewers might find interesting. And Fran, I'll take you back to 2010. There was a study done that said hospital amenities gain value over clinical care. And it basically said that hospitals are now using luxury services like upscale meals, private rooms, magnificent views, and valet parking to attract patients and gain market share. And the subline to that, or the underlying statement, was that this particular area, it was Baltimore, is full of top-rated hospitals, and they were using perks to give the hospital an edge because everybody just assumed that they were going to get good clinical care, and that patients were putting much more value on the quality of amenities like the big lobbies and the whole 9 yards. Now, that was then. 2 years later, in 2010, J.D. Powers and Associates, who does surveys on all kinds of things, they have found that the biggest key to patient satisfaction is not the hospital lobby or high-tech equipment, it's the staff. That patient satisfaction is most influenced by human factors. What do you think about that?
Absolutely. In my experience personally, dealing with healthcare providers and as a professional, if the people don't work, the building is just an annoyance.
Yeah.
Because then you think they spent all their money on the building, and why can't they get people to talk to me?
Yeah. Yeah, and there's a hospital not too far from us that has the most immaculate landscaping and trees and plants. Everything is just so beautiful. And you walk in the front door, and the few people that you see behind the desk don't even raise their heads when you walk in. That's the kind of mixed message you don't want to have happen.
Exactly.
Now, I thought it was interesting that the conclusion of the J.D. Powers study was that the survey encouraged hospitals to focus on staff. And they said, from the perspective of patients, it might be more worthwhile to invest in finding and keeping staff with superior interpersonal skills. And then they also talk about the HCAHPS that says, with patient satisfaction at such high priority under HCAHPS, hospitals shouldn't neglect patient satisfaction at the individual level. Even small changes in physician and staff behaviors can affect satisfaction. That sounds a lot like customer service to me.
It's exactly customer service.
Yeah. Do you have any thoughts on why the change from the buildings to the staff, and what's behind that?
Well, I think when they started to talk about competition and attracting customers, they thought the hotel experience was going to be the difference. Mm-hmm. And then once they implemented that and looked at the numbers, they realized that was not what was the issue. That what people really want is to have relationships, people talking to them, people they can feel comfortable talking to and trusting.
Yeah, and I would even echo that from our business standpoint. because as we sell the video on demand systems, we had a lot of hospitals early on ask us for the hotel experience, and we used to do the same thing in hotels, and I would do as much as I could to dissuade them from that, because one of the problems with the hotel system with patient education and entertainment is that the systems are complicated and there's not really a super easy interface. And what would happen more times than not is that patients who are not there because they're feeling well, if you think about your experience in a hotel, you're there because you're either on a business trip or you're there to have a good time. But when you're in the hospital, you're not feeling so hot. And so the more complicated it is to do stuff, the more frustrated you get. And we found that these simpler systems, not hotel-oriented, work the best.
That makes perfect sense. Yeah.
The patients liked them better, and the staff really liked them better because the nurse doesn't want to get a call from the patient saying, I can't find entertainment tonight or whatever, right?
Right.
Yeah. Now, there was an interesting comment in the one of the articles that talked about what patients want in a hospital. And this was different than the J.D. Power study, but it said that consumers were looking and comparing healthcare to other industries that they're used to, and they were expecting a lot of similar things. And the ones that popped out said that the ideal experience is built on non-clinical factors like convenience, customer service, and staff attitudes. And then it went on to say that providers should pay attention to the following. Facilities that offer multiple services in one location. To me, that says convenience, so that I don't have to go to 3 different places to get all my tests done. Ability to exchange information through online and mobile channels of communication. 65% of the people wanted that. Patient education during a visit, more than half wanted that. And then cafeteria and access to Wi-Fi and other entertainment, 53% wanted that. But the biggest one was positive experience with staff. Now, what do you think about the situation where they're looking for convenience, customer service, staff attitudes as it relates to anything from multiple services, information exchange, education? What are your thoughts there?
I keep thinking that if patient education was the focus, then all those other things could happen. I mean, you probably have a cafeteria already. Mm-hmm. You could add Wi-Fi. But in terms of getting customer service, having the patients feeling like they're listened to, having the conversations all the time, and then adding the patient education, I think that's really key.
Yeah, because if you start with that as a focus, all these other things organically happen from there, if you think about it. Because if we go back to the statement of having staff with interpersonal skills, if you started the recruiting process there and the training process there, so that it was all focused on things like education, engagement, and communication, if the people do that naturally, or as part of something they've been trained to do so that it comes across naturally, then it sounds to me like the natural organic result of that would be a patient that's pretty happy because they're being treated like a human, like a patient, as opposed to a file number or whatever.
Yeah, if part of your interview process is to find out how somebody applying for a job would deal with someone with low literacy skills, how would they interact, what would be their ways of communication, mm-hmm. then that could give you a sense of their personal skills, their ways of talking to people, their respect for people, and that could be a big factor in whether or not they're going to be successful.
Yeah. And you made an interesting comment before we started the show that kind of back in the day, the people that were drawn to healthcare were caring people from the beginning. They basically were. They would rather spend their time caring for other people than themselves. But today, the healthcare is a hot job market, so you're getting people that may not, have intended to go there. So that brings an interesting dynamic there, and perhaps one that you see daily. I don't know.
Yeah, it's a different kind of person that's coming to healthcare with different sets of skills, which are still valuable.
Sure.
I mean, especially people with IT skills and social media skills. I mean, those are becoming more important in healthcare.
Yeah, yeah. Now, one of the interesting things we just talked about recruiting. One of the conclusions from one of the studies talked about the importance of the patient-physician relationship and how that was so key and had the greatest effect on patient engagement. Now, that puts an interesting dilemma, I think, on the hospital, because the hospital can only recruit X number of physicians internally to either be hospitalists or whatever, but other physicians are actually external to the hospital. And so they may or may not be able to influence how that doctor focuses their patient relationship. So does that point back even more pointedly to the patient education role, perhaps?
Yeah, you might not be able to say to those external physicians, change your ways, but you could certainly say the philosophy of this hospital is that we will focus on and be the best at patient and family education, and that is what we expect you to participate in.
Yeah.
And by doing that, they can really move in the direction that they're looking for.
Yeah, yeah, and that actually makes a lot of sense, because if you think about that as almost a mission statement, why we're here, why we do what we do, those physicians that don't care about that will, perhaps want to send their patients elsewhere, and that could have a negative impact on their practice because word of mouth, people will hear that, this particular hospital does the best job of engaging and relating with patients, and you feel like a real person, and you learn a lot while you're there, and when you leave, you're able to take care of yourself. Well, hello, I'm going to go to doctors that want to make sure that they use that hospital. That's my conclusion.
Exactly.
Yeah.
Yeah, I think it could be a big long-term selling point for the organization.
Yeah, and I think long-term is the key. I don't think anybody out there at any hospital could flip a switch and make this happen overnight.
No. It'll take effort and consistency and persistence, but it's very doable because the skills relating to patient education are very simple, but complex on the other hand, in that they do take practice and persistence.
Yeah, I would agree. But it's clear as you look at the difference between 2 years ago and today that the focus, that what the patient is thinking about has changed. I'll give you two quick examples of how they affect me. One of the ones we talked about was the ability to exchange information online and through other communication. My wife and I, periodically we get blood test work done, prior to visits with our doctors. Well, the lab that we use has an app on your phone. And so we like to get our blood test results before we go. And that way we have time to look at them, and all the lab results always show where you're in range, where you're out of range. Well, that's a place to ask questions. What is this and why am I out of range? And sometimes we'll even look. I don't like to look too much online for that stuff because, a term can mean one thing for something else and then be totally irrelevant to the test that the doctor ran. So I don't put too much into that. But we do try to come up with some questions about, why is this out of whack or whatever. And that's an important one. We like that information ahead of time because the thing I hate more than anything is having a blood test, going to see the doctor, and I go, how are my results? Said, oh, they're fine.
Right.
I don't want to hear fine. I
want to know. Yeah, exactly.
I want the copy of the test, and I want to look at the numbers, and if this one's out of whack, tell me why, and if I should be concerned or not. And then the other one has to do with one of the, let's see if I can find it right quick. One of the comments was that the engagement and relationship with the patient ranked higher than things like money and convenience. And I would tell you that's true for me in a couple of ways. I'll use dental as an example. It is part of healthcare. But I go to a dentist that's 20 miles away. I live in Dallas, Fort Worth, and I probably pass 30 dentists on the way to go to this dentist that we use. And the reason we do that is because of the attention that we get when we go there.
Yeah.
I mean, it's a great no dental experience is great, if you know what I'm saying. But when you're there, and while you're there, they're attentive. They're talking to you. They're telling you what they're doing. They're asking you about what you're understanding and not understanding, and it's true engagement. And then they follow up after the visit, wanted to check, see how you're doing. And if I have an issue, I call in and I can talk to somebody quickly. We tried 6 other dentists in our local area, and we didn't get that. And so we drive out of our way for that. So,
yeah, my primary care provider is in the next town. I'm sure there's somebody okay here, but I found someone who has that personalized experience, and I'll do it.
Yeah. Now, you also mentioned that you had had a unique experience with doctors here recently about alternative communication. You want to share that?
Yeah, I had 2 annual visits with 2 different physicians last week, and both of them have online. It used to be that they would have websites that are just informational, and like where's our office and what are our hours. And now they've got interactive websites where you can actually look at your patient records and look at your lab results and ask questions. And both of these physicians, completely different, have actually the same system that they're using to communicate with me. And I think it's just great because now for a medication refill, I don't have to call and stay on hold for half an hour.
Yeah.
I can just email through this website and say I want a refill, and next thing you know it, they've communicated with my pharmacy.
Oh,
so I like the way things are going in terms of convenience. Also, I have a lab that has the same lab result app thing you have, and I was able to forward my specialist labs to my primary care provider before I went to my primary care provider, so that she had that too.
Yeah. I know I've told you that I'm a big proponent of Evernote, and I forward all of the medical stuff for me and my wife and my mother in the past when I was taking care of her, and had all that instantly there. And so whenever I went in to see any of those doctors, if they had a question, I had a history with me. And whenever, like when my mother was ever discharged from the hospital, I'd go back within a week and ask for the entire medical record. I said, I don't want films, but you give me everything else, because invariably when we do follow-up with a different doctor, they say, well, let's run a lab test. I said, no, I have the results right here, and they're fresh. And that saved a small fortune. In extra tests that they said, oh, you do? And then we'll say, can I have a copy of this? And it's because that's your copy. I made one just for you. And it always wound up in their files. These were doctors that still use the paper. But that's really encouraging that you had that experience. I'm looking forward to that as well. Well, I guess we should probably wrap this up. I think the two of us could talk about this for a while. But I want you to summarize what you think the most important thing is, because you said it earlier, but let's leave our viewers with the one key thing that would, if the CEO of Baylor or one of the big hospital groups were to call one of us and say, what should I do? What's your thought?
If that person were to call me, I would say, change your mission statement and say you're going to be the very best at patient and family education, and then do everything you can to support that, build the infrastructure, make the resources available to your staff, make them easy to access, teach them the skills to provide patient education, and everything else will fall into place. Customer service, picker scores, everything will fall into place if your people, everyone who works for your organization, wants to make sure the patients and families who come to your organization know patient education.
I couldn't agree more. I think it makes total sense. Well, why don't you tell people where they can find you online?
Oh, okay. I'm at www.notimetoteach.com, which is the title of my book.
Hmm.
And I'm on Twitter also every day at No Time to Teach.
Yeah, and I would encourage folks, if they haven't bought your book, it's available wherever books are sold, and it's available in two forms: paper, and also you can download it for Kindle or other e-readers. And it's a great kind of pocket piece to have with you at all times, because there's good practical advice in there for patient educators or anybody that's interested in patient education. And for hospitals out there, if they would be interested in a volume purchase, if they go to your publisher, which is Pritchett and Hull, and their web address is p-h.com, there's a significant discount for volume purchases where you could provide the book to a lot of your staff, and would encourage you to do that. And I would like to let everyone know that the Patient Educators Update is brought to you by Synergy Broadcast Systems. And our patient education video on demand system, we call it MMDS, or Medical Media Delivery System. And it enables hospitals to deliver video on demand patient education as a tool to support nurses and patient educators, and provide patients with extra opportunities for education on demand when they're ready, what we call that teachable moment. And that's also one of our episodes. So, Fran, thanks very much for your time and attention today. I thought it was a great session, and I'll see you probably next week.
Yeah, thanks, Chuck.
Okay, thanks. Bye-bye.
Bye.